March 30th is Bipolar Awareness Day, and in recognition of this, we're going to present a two-part series of shrink shorts, which will tell you what it is, how it is treated, and how it represents itself in our society. Manic depressive illness, as it was called in the 19th century, when the German psychiatrist Emil Kraepelin first identified it as a distinct form of illness, has affected humankind for centuries, if not millennia. And it consists of a susceptibility to develop extreme mood swings between euphoric excitation and intractable sadness that's more intense and sustained than any normal person would ever experience. Think of it this way. In the course of our lives, we routinely experience emotional highs and lows in response to life events. The human brain is endowed with the capacity to regulate our emotional reactions to these so that they are proportional to experience's intensity and the duration, so that you don't become morbidly depressed over losing a glove or euphoric over winning at bingo. These are emotional guardrails that maintain an equilibrium and a resilience to the challenges of daily life. But in people who have bipolar disorder, these are lacking. So there is the potential for them to go to emotional extremes that are excessive and persistent and manifest in the symptoms of the disorder. So depression consists of a sadness that is palpable, physically painful, endless worry and rumination, blaming themselves and racked with guilt, hopelessness that nothing will ever help them, and feelings that life isn't worth living. Mania, on the other hand, includes racing thoughts, high spirits or irritability, abundance of energy and overconfidence, and uncharacteristic behavior, which is risk-taking sometimes. Normally conservative people become promiscuous, spend huge sums of money, or begin grandiose business schemes. The onset of this condition begins usually in young adults through middle age, and it affects 1% of the total population. That means 1 in 100 people will develop it. The cause of this is genetic, not one gene, but multiple genes, which confer a heritability of 80% to offspring. The illness, if caught in time, is very treatable and can nip the illness in the bud. But if it isn't treated, it can be devastating and ruin people's lives. Now, I'll have more to say about treatment in the next shrink short. Now, there are many examples in literature and in public life of people with bipolar disorder. The classic example in literature is Hamlet, which Shakespeare wrote in the 16th century. His to be or not to be speech is the most famous example of melancholia in literary history. And his manic state is reflected in numerous lines in the play, such as, "In my heart there was a kind of fighting that would not let me sleep." Charlotte Bronte's classic novel in 1847, Jane Eyre, describes Rochester's first wife, Bertha, as a classic case of bipolar disorder. She succumbs to this illness and must be locked in the castle tower until she finally jumps to her death from the parapets. Now, there are many examples in public life that you may or may not know from their behavior that have bipolar disorder. Vivien Leigh, the great actress, Ted Turner, the entrepreneur who founded CNN and cable news, and the scandalous behavior of Kanye West was largely attributable to his bipolar disorder, which was not being effectively treated. Problem is that bipolar disorder's symptoms blends in with people's personalities, and their individuals around them don't recognize this as symptoms of an illness, but they think it's just extremes of his colorful behavior. And this delays diagnosis and treatment. This is how problems arise, but they can be stopped. Treatments like mood stabilizers, lithium, anticonvulsants, adjunctive medications work. They can suppress the symptoms and prevent their recurrence. So the take-home message is this: be alert in yourself and in the loved ones around you to the symptoms of bipolar disorder. And if you think they're occurring, seek evaluation and treatment from a good doctor with experience in mood disorder. And if you do this, you can nip things in the bud and lead a normal life. So till the next time, this is Dr. Jeffrey Lieberman for Shrink Speak. And stay tuned for the next Shrink Short.